Hello friends, in today's class we will discuss 10 right things of medicine administration. 10 rights of medicine administration. So these are the 10 things that you always have to keep in mind whenever you are administering a drug to a patient. So suppose you are in a ward and you have to administer a medicine. So what is the first thing that you are going to find out? So the first thing is right patient. You have to identify the patient to whom the drug has to be administered. Now once the patient has been identified, what is the next thing that you will find out? It is the right drug. What comes along with drug? Once you know which drug has to be administered to the patient, what is the next thing? You need to know the time. You need to know the route of administration, and third thing, you need to know the dose of administration. ठीक है? So what are the next rights that you have to do? The right time of administration, the right route of administration, and next the right dose. Dose is very important for you. Okay. Now you have identified the patient, you have identified the drug that has to be administered to the patient. What is the next thing you are going to do? The next you are going to do is you are going to find out whether the patient is ready to take the drug or not. I'll explain how. Suppose you are planning to give a blood transfusion to the patient. So before blood transfusion, you take vitals for that patient. You see the patient does not have a very high BP. You see that the patient does not have a temperature. The patient does not have a running fever. In case the patient has a running fever, you first give him paracetamol or any antipyretic, and after that, once the fever has settled, then you start transfusion of blood. So similarly, for any medication, whatever the prerequisites are, you have to first assess the patient accordingly and then start the medication. Okay. Now, what is the next thing? Now you know the patient, you know the drug, you know that the patient is ready to take the drug. Now you will see the drug charting, and you see that there is no other drug which is going to cause drug interaction with the current drug that you are going to administer now. So you need to know the right drug interaction. Now you know that your drug is safe to safe to infuse, give to the patient. What is the other thing? What is the next main important thing that you're going to do? It is right documentation. Why is documentation important? You are giving, let's say, metronidazole to the patient. Now you have given it once and you forgot to give it and hand over to your to the next staff. Okay, but once you have written it in the documents, it is there that one metronidazole has already been administered. So it will be easy for the other one to know about it. Also, it is important for your general record keeping. So documentation is very important. Now, what is the other thing? Now, all of this has been done. Now you have to administer the drug. So for doing any procedure or for giving any drug, what is the most important thing? The consent of the patient. Okay, so these two things go together. First is your right to refuse. Where will this right to refuse come from? When you are going to take consent that we are going to deliver this drug to you, and the patient says, no, I don't want this drug. No, I have had previous allergies from this drug, so I won't take it now, or any other reason. Okay, So for that, what is important? Right education. You should be knowing everything about the drug, and the same information you have to give it to the patient. Okay. Now the patient has right education regarding the drug. What is the mechanism of the drug? What is the side effects of the drug? What is the actual effect of the drug? Now knowing all of it, the patient can accept or refuse. So there your right to refuse comes. Okay. So whenever you are administering any drug to a patient, all these 10 things have to be followed. It should always be a checklist in your mind, and this should be done for each and every patient and each and every drug. Thank you.